Bismillah ar-Rahman ar-Rahim. In the lecture series from PIAS, which is Pakistan International Academy of Superior Sciences, our main heading is the pain in the abdomen, which means पेट का दर्द या पेट में दर्द. Today is the second lecture of that series and the topic for today is appendicitis. Appendicitis जिसको आम लोग appendix कहते हैं, appendix है वही, appendix है इसका. तो ये statistically speaking, by the statistically speaking I mean to say that if you come across or 100 patients are presented to you with the complaint of pain in the abdomen, by and large majority of the patients are the patients of appendicitis. So it means that the incidence or the prevalence rate of this problem is very high. The prevalence rate means that the number of the patients coming to you in the OPD or emergency, the number of the patients out of the all patients who are presenting to you with the pain in the abdomen, the number of appendicitis is very high. This magnitude of the disease or the volume of the disease is also called in medical terminology the disease burden. So out of the many diseases which are brought to you as pain in the abdomen, the incidence or the prevalence rate of this appendicitis is very high. So in the patients of the pain in the abdomen, the patients of appendicitis are very high, their number is very high. So you must, and this is also a medical or surgical emergency, so you must be fully equipped and must have full command on the management of this disease. So what the picture would be that usually this patient will be in the age of teens. He will be a patient of 11 years, 12 years up to 19 or 20 years. So they are young patients. By and large means mostly they are young patients. So I have given the term teenagers. They are teenagers and they would be presenting to you along with the pain in the abdomen. They will also be by and large or majority of the patients would be complaining of also nausea and vomiting. That they will be saying to you that I am feeling मुझे उल्टियाँ आ रही है, मुझे दिल खराब हो रहा है, उल्टियाँ आ रही है. So this is also one of the clinical features that mostly patients would also complain of with the complaint of nausea and vomiting. Nausea means दिल खराब होना, vomiting उल्टियाँ होना, ठीक है. And also they will be if you ask them as to show me the site, exactly point out the site where do you have pain in the, because abdomen is a large region, and if you ask them as to exactly locate, what I say to the patients mostly that I say put one finger or the index finger, this is called index finger, put one finger as to where do you have pain exactly, show me or tell me, point out the place where do you have the pain. So they will be putting their fingers on the right iliac fossa, which I have yesterday told you that where is the right iliac fossa. This is the right iliac fossa, okay. So they will be putting their fingers in the right iliac fossa exactly or sharply marking a point which is called McBurney's point. McBurney's point. What is McBurney's point? If you draw a line from the umbilicus to the anterior superior iliac spine, right superior iliac spine. If you draw a line, imaginary line from the anterior superior iliac spine to the umbilicus, or from the umbilicus to the anterior superior iliac spine like this, I have drawn a line for you, okay. So if you draw a line and you divide this line into three portions, portion 1, portion 2, portion 3. If you divide this line into three portions, the portion which is the junction of the lateral 1/3, this is lateral 1/3, this is the medial 1/3, medial most 1/3, and this is the middle 1/3. अगर आप इस लाइन के दो हिस्से अम्बलाइकस की तरफ छोड़कर तीसरा हिस्सा एंटीरियर सुपीरियर स्पाइन की तरफ अगर ये जंक्शन आप लोकेट करें, तो दिस इज कॉल्ड मिक-बर्नीज पॉइंट आफ्टर द नेम ऑफ द सर्जन. मिक-बर्नी was a surgeon who diagnosed this as the exact site where the pain of appendicitis is felt mostly or severely. Why this is so? Why not here in the medial 1/3? Why not here in the lateral? In here, why particularly or exactly at this junction? Because the appendix is lying right behind this point. Mind it that the appendix is lying right behind this point. And which part of the appendix? The base of the appendix, where the appendix starts. Where the appendix starts. This is the place where the small intestine ends in the abdomen or terminates in the abdomen, and the large intestine starts. The large intestine starts, the small intestine ends. This is the junction called ileocecal junction. What? Ileocecal junction, because the ileum part of the small intestine has got three portions or three parts. Number one is duodenum, second is jejunum, and third ultimate last part is called the ileum. So ileum ends, and from the terminal end of the ileum starts the large intestine. गटाकुल बड़ी आंत शुरू हो जाती है. So that point or that junction is called ileocecal junction, and the start of the large intestine is that part is also called cecum. So the appendix is actually suspending from or is suspended from the cecal part of the large intestine, and this is that place where the Mick-Burney pointed out and the Mick-Burney demarcated it. So this is the place where the base of the appendix is lying, and this is called Mick-Burney point. If you put your finger over the Mick-Burney point or at the Mick-Burney point, the patient will jump. And what I say to the एक उंगली पर तुम उठ गए, ये कैसा दर्द है, वो कहता, और दूसरी तरफ आप देखेंगे उसको कुछ महसूस नहीं होगा. तो अगर आप एक उंगली मिक-बर्नी पॉइंट पर रखेंगे और बहुत बड़ा पहलवान होगा, तो वो बहुत बड़ा पहलवान आप एक उंगली से उठा सकेंगे. ठीक है, तो नेवर फॉरगेट that put one finger on the Mick-Burney, which is the point of maximum pain, and this jumping or feeling pain at that site is called tenderness. At Mick-Burney point. You got it? Mick-Burney. So maximum tenderness, सबसे ज़्यादा दर्द जो होता है at Mick-Burney point, because the base of the appendix is lying there. Okay. So what will you do? Now you are concluding. Okay. So now you have idea that the patient is having appendicitis. Rough idea how to prove it, how to confirm it that really it is appendicitis and nothing else. Then you investigate. You go for investigations, and investigations are not particularly done for finding out or diagnosing the appendicitis. Investigations are primarily meant to exclude other diseases which may present to you as a pain in the right iliac fossa. ये टेस्ट हम इसलिए नहीं करते कि ये पता लगाएं कि appendicitis है कि नहीं है, हम इसलिए करते हैं कि कोई और बीमारी ना हो. तो these are actually not the confirming tests, but these are actually the exclusion tests कि और बीमारियां आप उनसे निकाल लेते हैं कि कोई और बीमार कोई और चीज़ ना हो, ठीक है। तो उसमें क्या आप क्या करते हैं कि एंड माइंड इट that all these investigations are by and large mostly normal except one test, which is the test in the blood. This is called TLC, total leukocyte count, the white blood cell count, which are usually raised. The normal value is up to 4 from 4, 5, 6. This is the normal range. Maximum could be 11,000, but usually 4, 5,000 is the normal. But in this situation, usually the TLC in the blood test is raised. This is confirmed. This is the only test which gives you idea about the appendicitis. Otherwise, particularly the ultrasound will be normal. Ultrasound doesn't tell you about the appendicitis. And the urine test will be normal. Okay, the rest of the test, blood urea will be normal, the serum creatinine will be normal, except the TLC, which is raised. But the confirmation of appendicitis is the presenting feature and your finger test. Okay. Moreover, the patient will not be relieved. There will be no relief with medicine. You will be giving the medicine, and the patient, the pain will not be relieved. And also, there is no the X-ray also. People are doing X-ray KUB for kidney, urinary bladder and ureters in order to exclude any stone in the kidney, any stone in the ureter, any stone in the bladder. And this X-ray, the black and white X-ray, which is called KUB X-ray, kidney, ureter and bladder, these will exclude the possibility of stone in the urinary system, which may present to you as pain in the right iliac fossa. Mimicking means having similarity, mimicking the picture to that of appendicitis. Okay. So, you will do all these investigations not to confirm appendicitis, but to exclude the other diseases. Once you come to know that this is appendicitis, the only treatment of appendicitis is operation, and that operation is called appendicectomy. Well, appendicitis by itself is also a dangerous situation, a dangerous disease, but the complications of appendicitis are alarming, are fatal if you don't manage it. And these complications in time, the complications are perforation of the appendix, which is called burst appendix, and there is pus in the appendix, and this perforation, this pus, the perforation gives pus, the perforation leaks the pus, the pus into the peritoneal, general peritoneal cavity, and this results into peritonitis, which is a very dangerous, a very fatal situation. Okay. And also this may not burst, but this may go into ongoing or chronic picture, which is chronic inflammation of the appendix, and may give you a mass, which is called appendicular mass of the appendix, and this also is also a very problematic situation. So, cannot be managed so easily as the appendix in the beginning. As the appendix in the beginning is a manageable situation, so if appendix gets complicated and if you do anything, it will be very difficult to save the patient. So, my advice to you is to timely manage. If you suspect appendicitis, then don't hesitate to do operation so quickly and so soon as possible. Okay, because of its severely fatal complications. Okay, any questions? Any questions? Write down. Okay.